All right, well, good morning again, everybody. Joe Gladys with Flexible Benefit here. We're going to go ahead and get things started for you. I want to take this moment to thank everybody who's joined in on the call, and I'm sure we're still going to have a few more people popping in over the next minute or two. But again, this is the maiden voyage of our Increase Your Income with Individual Ancillary Plans. And with all the turbulence that's going on in the marketplace today, especially in the individual market, your success more than ever is going to revolve around adding these ancillary plans into your solutions for your clients. Your clients need these products. We've got to make sure that we're offering them, and we've got to look for opportunities to help us replace that income that we're losing, especially in the individual market. So welcome. We'll hopefully have some very valuable information for you as we make our way through this presentation. All right, so as we do with every webinar, we always start with a brief overview of Flexible Benefit because we have all sorts of different people from all different experiences with us. Some may be new to Flex, some may have been with us for a long, long time, but we just want to give you a quick, brief overview before we get things started. All right, so Flexible Benefit Service Corporation was founded in 1988. We're located in beautiful Rosemont, Illinois, right next to O'Hare Airport. We've got about 75 full-time employees, and we offer services in two main business segments. We have our general agency side, which I work on, helping our brokers in the individual and Medicare space. Also, the group sales, which is a different department, but we all fall under the general agency side. Then there's the benefits administration side of our business. On the general agency side, we like to say that we offer you concierge-like services for producers in the group, individual, and Medicare marketplaces. We provide you with assistance in sales, service, marketing, and business processing functions. And I think the big thing that we like to say that separates us from all the other general agencies is the amount of training that we offer, like today's webinar, our in-person workshops that we do, all designed to help you be more effective out there serving the clients and increasing income opportunities for yourselves. So we're here to help you in any way we can. On my team, we also have Larry Kassman and Marianne Graben. So most of you are probably familiar with them that have been with us for a while, but any of us are here to help you guys. That's our function. Down below, you see some of the major carriers, and we are the only general agency in Illinois that can offer you United Healthcare, Blue Cross Blue Shield, and Aetna under the same roof. All right, on the benefits administration side, and that's actually where Flex got its start, we offer products like flexible spending accounts, HRAs, health savings accounts, COBRA administration, wrap documents, so on and so forth. Okay, we have a full dedicated staff to serve that. We actually own these products. We don't farm them out to third parties or anything like that. Very competitive pricing. If you or your clients need any assistance with that, please contact us. We'll get you to the right people on that side of the business to make sure we get your needs taken care of. Just as an FYI, we have thousands and thousands of clients nationwide using our services. We are one of the two preferred HSA vendors for Blue Cross Blue Shield on the HCSC portion of their business, and those products are available both on the group side and for individuals. So if you need any help again on any of this, please let us know. We'll get you to the right people. All right, so let's talk a little bit about what we're trying to accomplish here. With the upcoming open enrollment for under 65 and the annual enrollment period about to begin for Medicare, Medicare will start October 15th. The open enrollment for under 65 will start November the 1st. We need some additional strategies in today's marketplace to help us be better agents for our clients. And like I said earlier, to help us replace some of this lost income that we've been losing in the individual market. Not only are we seeing our commissions eliminated during the SEP period, but over the last 5, 6, 7 years, we've seen drastic reductions of those commission levels as well. So we need new strategies to protect our income and, of course, protect our families. Okay, so looking at the agenda for today, we'll give you an overview of why we're here and what we're trying to accomplish, some strategies to help you get there, take a brief overview of some of the ancillary products that we have available to you today, including life and final expense, dental, vision, hospital indemnity, and critical illness plans. All right, we'll lay out a little path to success, and then we'll wrap things up for you. All right, so how are we going to go about earning incremental income and retaining your clients? Because that's what ancillary sales really means at the end of the day. It's an opportunity for you to earn more dollars on that sales call, and the more products you sell to your client, the higher your retention rate is. I was fortunate that I came from an agency before joining Flex where this was very much a way of life. Every client we worked with didn't just buy a health product. We added some sort of ancillary, whether it was life, whether it was vision, whether it was dental, whether it was critical illness, whatever it may be, to better protect the client. And we'll talk more about that as we make our way through the presentation here. All right, so why are we here today? Well, the objective is that in order to increase your income opportunities and build client retention, you should be offering ancillary plans to your clients and prospective clients. By having these new products in your portfolio, it gives you a great reason to reach out for your existing clients and touch base with them. Hey, Bill Jones, I was thinking about you when we talked about this, and I've got this new product that might fit that need for you. Do you have 15, 20 minutes where we might be able to get together? It just gives you an opportunity to get back in the door. And of course, with your new prospective clients, you have an opportunity to fill more of their needs. All right? You've got to learn to cross-sell these products in both the under 65 market and for Medicare clients. And I'll talk about both of those categories in a little more detail here. But most of the products that we're talking about here today can be sold to under 65 and over 65 clients. Okay? And a key part about this that people tend not to understand, a lot of the people that we're working with are coming off of a group plan, whether it's just a change in life for the under 65 people, or whether it's somebody leaving their job and heading into Medicare or retiring and becoming Medicare age. Okay, in that world, these people are used to having all these additional benefits wrapped in with what they consider to be their health insurance. Because it's not only health insurance. Typically, that employer offers some level of life insurance. They offer vision and dental, maybe some accidental death or short-term disability. All those different products that people have had all along and kind of taken for granted. Now, when you come out to the individual market or you get cut free and head off to Medicare, these products are no longer included. The health insurance plans simply cover health insurance. Okay? All right. So, ancillary products give you a reason, again, as I mentioned, to reach out for your clients and cement that relationship that you've had with them. It's a great opportunity, even if nothing comes from it, other than, hey, I was thinking about you. Just touching base, wanted to let you know I've got these additional new products. If it fits, great. If not, hey, that's fine as well. But it just gives you reasons to touch your clients again and reach out to them and stay in touch with them. All right. So you really have a couple of paths that you can go down with this upcoming open enrollment and annual enrollment for Medicare. You can do what many of us have done for years and years and years and years, and that's just go out and fill their needs with the health-only product. And hey, you're helping them. You're definitely going out and helping them. They need these products. Or you can take the better path for both the client and yourself and offer them health and ancillary products. So let's talk a little more in detail about that. All right, on the individual side, I mentioned it earlier, but carriers have been reducing and eliminating our individual commissions. So it's more critical than ever to protect your clients and incrementally, easy for Joe to say, incrementally increase your income by offering these ancillary products. Cross-selling is the key to your future. Adding in the proper mix of ancillary or supplemental products such as life, dental, vision, hospital, indemnity. These products help protect your clients, fill their needs, and give you an opportunity to build a better relationship with your client. The key to all of this is what we like to call a thorough fact-finding. Okay, and this is where you're going to uncover your client's needs. Okay, we all come in, we all do that intro and kind of, hey, how you doing? Nice to meet you, and all that good stuff when we first get there. And you've got to do that warm-up when you get there, because that first impression you make with a new client goes a long way towards determining success. But once you've gotten beyond there and you've kind of stated your objectives, by asking open-ended questions of your clients, you're going to uncover additional needs. we always used to say at my previous agency that the health insurance got us in the door. Where we made our money was with the ancillary products because they have very high commission rates. And those of you who are currently selling life insurance know that life insurance pays very, very well. These additional products today are where you make your money. Even when we do get paid commission by the carriers for the under 65 insurance, we're not getting a whole lot of commission. Like I said, that's been cut and cut and cut over the years. And now during SEP, we're not getting paid at all. The news of Harkin coming out this week that, hey, guess what? We're not going to pay you guys any commission. We don't want you. We don't need you anymore. Okay? Harkin's a little different model, and that's a little different story going on with them. But at the end of the day, you know, there's still probably times when I may refer a client to Harkin because it's the best solution for them. But I'm certainly not actively putting them out there anymore because they don't want to pay me. All right, so we've got to find other ways to protect our income. All right, ultimately, by doing this thorough fact finding and uncovering your client's needs, you're going to end up with a client that's better protected, and you as the agent are going to have a much better shot at retaining that client. The more products you sell, the higher your retention rate's going to be with your clients. And I was trying to find it before the presentation here, but I could not find it. But there was a great stat out there that I saw about a year ago that says that if you sell a client one product, you have about a 20 to 23% retention rate after 1 year. If you sell them two products, it's closer to 50%. If you sell them three or more products, your retention rate is nearly 80%. So the more products, the more you help that client, the more you cement your relationship with them, the longer they're going to be your client. And this is critical going forward, guys, because what is the hardest thing for all of us to do in this business? Get new clients, right? That's where we have to spend the biggest amount of our time. And what's our most precious commodity as agents and brokers? It's our time. All right? So let's make things easier for ourselves. Let's get more with each client that we help, and by doing so, we're going to get more referrals, and we're going to keep those clients on the books longer because they're happier and more satisfied. All right, those of you who know me and have listened to me speak before, either with in person or on a webinar or over the phone or emails, know that when I have the opportunity, I'm going to give Medicare a little plug here. I'm very passionate about the opportunity in Medicare. All right, there's tremendous opportunity. And for those of you who have only been doing individual sales, the natural partner, companion, individual is Medicare. When I first started in this business, all I sold was individual plans. I didn't want anything to do with Medicare. And after a few years, more and more of my clients were aging in, and I was just handing them off to other agents in my office. And again, what did I just say? What's the hardest thing for us to do? Get new clients. And when my clients needed me the most, because there's so much confusion with Medicare, I was just handing them off to somebody else. Today, we get paid very, very well for Medicare. It doesn't make sense in today's marketplace not to get certified to sell Medicare. Okay? Many of your existing clients, just like mine, are beginning to age into Medicare in record numbers. We all know about the baby boomer population explosion of 65-plus-year-olds. Depending on whose numbers you're looking at, it's anywhere from 10 to 12,000 people a day turning 65. All right? And the sad part is this segment is badly underserved by agents, especially here in Illinois. We've got this massive population explosion, clients completely confused about what their options are when it comes to Medicare. CMS will tell you that 92% of all Americans are completely confused about their options with Medicare. Okay? And at the end of the day, we also have an aging broker base, so we have less brokers available to help these clients when they need us the most with Medicare, and there just are not enough agents helping these people, and they're confused, and they are extremely loyal. You have much higher commission levels with Medicare health sales than you do with individual health sales. And seniors need to balance out their benefits with supplemental products like final expense, indemnity, dental, and vision. These are the first questions out of my senior market sales clients. Oh, what about dental and vision? And final expense and things like that. These are the first questions after we get through the health stuff, because Medicare does not look at vision or dental as being medically necessary, so they are not covered expenses. So there is opportunity. Clients are looking for it. They had it on their group plan. They need these services more than ever as we get older. So make sure that you're getting boned up on these products so that you're able to offer them. Okay, but if you're new to Medicare, you haven't gotten into the Medicare game before, don't despair. It's really not hard. It's actually pretty simple once you understand how it works. And Flex is here to help you get ready to sell Medicare products. And now is the time to do it. Our business is slower in the summer. We're a couple of months out to the open enrollment periods. Now, more than ever, is the time to do it. We have a clear-cut strategy and training roadmap that gets our brokers contracted, certified, and ready to capitalize on the best and fastest-growing opportunity available in health sales today. And that is Medicare, people. You need to get in the game if you haven't done so. Like I said, it's far easier than you think, and it's far more rewarding, both personally and financially. And it comes with far less service headaches than the current state of our under 65 business. When I'm done with a Medicare client, I almost never hear from them unless I reach out for them. Once you've uncovered their needs and got the right solution for them, they tend to stick with that plan. Okay, so it's much easier, far less headaches, and the people are truly grateful, and I get far more referrals from Medicare clients than I do under 65 clients. Okay, the certification season has opened. It's time to start now and capitalize so that you're ready to sell during the upcoming annual enrollment period that begins on October the 15th. All right, that's enough of Joe's harping on Medicare. So let's get into the actual products that we have available for you going forward. All right, the supplemental or ancillary products that you're going to be able to help your clients with. We'll start with life insurance / final expense. We'll get into some of the dental plans, vision options. We'll talk about hospital indemnity plans, and then critical illness. All right, so with life insurance, many of you probably are not aware, we did send out an email blast, but at the end of the day, Flex can now offer you access to the top carriers in the industry, including John Hancock, Legal & General, some of you may know them as Banner, Lincoln Financial, MetLife, Nationwide, The Protective, Prudential, all the top carriers in the marketplace. We have access to them now as your general agency. Okay, it's really simple. We're not asking you to become experts overnight, but I will tell you, as I mentioned earlier, life insurance pays, and it pays very well. It is definitely worth bringing up with your clients. Okay, we've created for you a simple one-page quote request form. You get some basic client information, and Flex will do the shopping for you, and we will send back to you the best quote option for your client's particular needs. There's all kinds of different things, and for this we're really talking and focusing primarily on term life insurance, but at the end of the day, if you have other needs, let us know. If you have somebody that needs an index plan or a whole life plan, let us know. We can help you with that, but this is primarily focused towards term life. And here's why you want to get involved in the life insurance game. Only 38% of adult Americans own a life insurance policy. 70% of those who do own a policy are severely underinsured. People really, really underestimate their value. I had one of my clients call me up a couple of years ago, and he works out in Yorkville at the King County Correctional Facility there. And he needed to get $100,000 life insurance to cover his daughter through a divorce decree. And I said, that's great. I'm more than happy to help you with that. But I said, you might be surprised at how much you're actually worth, because I know you want to take care of Lexi if something were to happen to you. And he said, well, what do you mean? I said, well, listen, when I come out there, we're going to do a 5-minute assessment of your basic needs, and I think you're going to be surprised at how much you're actually worth to her. And this particular individual said, I'm not going to pay for her college. Everybody looks at this different. But I want to make sure she's taken care of if I'm not here. I said, well, that's great. So we rolled up the numbers, and it came back and said, without covering college costs, because we all know how high that is, it said at a minimum he needed $650,000 of term insurance. his eyes just bugged out. He was like, oh my God, I can't believe that that's really my value. You know, Lexi was 2.5 years old at the time we were doing this. We've got to provide for her for the next 16 years till she does go off to college, but he wanted her to pay for it on her own like he did. Okay? That's fine. Everybody has different objectives when it comes to that. There's no problem with that. It's whatever your client needs. Turns out with his budget at the time, $650 was a little steep, so we did a $500,000 policy. But it's, again, a simple fact-finding with the client leads to greater opportunity. Okay? So if I would have just done, hey, okay, he wants $100,000, here you go. Okay, if somebody walked in and handed you a $100,000 check right now, you'd feel great about that. That would be wonderful. That's a lot of money. But over the span of a child's lifetime and taking care of their needs or your family's need, multiple children and a wife left behind, that doesn't go very far. So that's why you got to do the fact-finding. 1 out of 3 Americans would be in immediate financial distress if they lost their main source of income. So if that breadwinning spouse were to pass away, immediately 1 out of 3 households is going to be in financial distress. They don't have enough money to survive a month or two. That's the current state of finances in America. Half of American families would be in total distress after 6 months. So in other words, this is why life insurance is critical. Life insurance is an emotional sale. Nobody ever wants to bring it up, but because of something that happened to me with one of my clients, I made a vow that I never leave a client's home without at least bringing it up. Doesn't mean I'm going to get a sale, but I am going to bring up life insurance every time. That's typically a follow-up appointment, and with Medicare, you cannot sell life insurance during that Medicare appointment. You have to do a follow-up. But at the end of the day, it's a follow-up appointment. It's a great opportunity. Again, people are underinsured. We're here to help them. They need to protect their families. In fact, in a recent survey, 50% of Americans say that they need more life insurance. But for some reason, it's something that people don't actively pursue. We as agents have an obligation to bring this up to our clients and make sure they have the coverage they need. Okay, first-year commissions will vary a little bit by carrier, but on average across the board, you're looking at nearly 80% first-year commission. So if you think about that, and you sell somebody a policy that maybe has a $200 a month premium, $2,400, and you're getting 80% of that, that's a nice little payday by just asking a few more questions on the appointment. All right, final expense is actually the fastest growing segment of the insurance industry at this point. Why? The average cost of a funeral in the United States is $15,000. That's for just a decent burial and all the expenses that go with putting our loved ones to their final resting spot. Okay? I just recently experienced this with my mother-in-law right before Christmas, and we were at about $20,000 of total expense when it was all said and done. Fortunately, we had bought prepaid packages for all of that to make sure that those things were taken care of, because too often it falls on the surviving family members to cover this expense. Okay? So final expense plans are designed to cover this sudden income hit so that the loved ones left behind aren't scrambling to cover the costs. Okay, and this happens far too often. In my mother-in-law's case, we're talking about a blue-collar seamstress that worked hard for her money, but she didn't have much left at the end. If we hadn't pre-purchased these packages, my wife and the other surviving siblings would have had to come up with this money, and that would be a financial hit for all of us. In fact, burial and final expenses are the primary reason that Americans purchase life insurance today. They don't want to burden those left behind. These final expense plans are basically whole life plans. You can buy $2,500, $5,000, $10,000, $15,000, $20,000, $25,000, maybe up to $30,000 to cover these expenses and maybe have a nice little luncheon or dinner afterwards to celebrate your loved one. But why not get this taken care of up front so that your family members left behind are not getting hit with this expense? Here's another great number. 35 million households have no insurance at all in America. When these things hit, the loss of income, the loss of a loved one, suddenly it's bad enough to go through that stress of a loss. Now you also get hit with the double whammy of the financial hit as well. So that's why these products are critical in helping our clients. All right, types of final expense plans, there's really 3 out there. They all offer simplified underwriting, much looser than typical life insurance policies, because they know with these plans, people are going to pass away. Unfortunately, we aren't made to last forever. But depending on your health is going to determine what type of plan you're eligible for. The first one is called Level Immediate Death Benefit. With this one, these are for people that are in good health, and the payment of the entire face amount is available to the beneficiary upon death of the insured. So it's available immediately. Okay, when you sign up for it, they're expecting that you're going to last a while and you're going to pay some premiums in. But because of your good health, God forbid something happens 3 months afterwards, you get the full amount of the death benefit. Then there's graded death benefit amounts. Here, a percentage of the death benefit is paid out depending on how long the policy has been in force. Typically, you're going to see 30% at the end of year 1, maybe 60% at the end of year 2, and in year 3, 100% of the benefit becomes available. So this is for somebody who maybe has a few more health issues and there's a little more risk for the insurance carrier. So they're going to hedge their bet a little bit before they pay out the entire amount of the benefit. Then you have the modified death benefit. If the death occurs in the first 2 years, the policy will pay all the premiums plus 10% back. So in other words, this is somebody who does have more serious health issues, so there is definitely more risk for that insurance carrier. And so what they're saying is, if you die in the first 2 years, we'll give you all of your premium that you paid in back, plus 10%, because you know the insurance companies take our money and make money on it. If the death occurs in the 3rd year, then you get 100% of the face value. So that's how your typical final expense plans are going to work. So basically, as you're scrolling through these options from the level immediate death down to the modified death benefit, you're going from healthy and affordable to sick and more expensive. All right, so again, that level immediate, those are for the healthier people. The premiums are going to be lower, and the benefits available immediately. Work your way down to modified death benefit. That's for people in poorer health. And yeah, there's going to be a higher premium for that because they know there's a higher likelihood that they're going to be paying out. All right, currently for final expense carriers, we can offer you Mutual of Omaha and Medico. Hopefully we'll have a couple more carriers available here in the very near future, but right now those 2 carriers, and they do have very competitive rates, and so that's what's available for you at the moment in terms of final expense. But this is something that I would definitely bring up, especially with my Medicare clients. And a lot of times it might not even be the client themselves, but the children of the clients that are interested in taking out this policy so that they're not being hit with that $15,000 or $20,000 expense when they have to put one of their parents into their final resting spot. Again, these are emotional and financial hits for people. And life insurance is that emotional sale. You've got to tap into that a little bit and tap into the side of it. It's not just the loss of that loved one, but it's also financial strain on everybody left behind. All right, let's talk a little happier stuff here. Let's talk about dental, which is one of Joe's favorite subjects because Joe likes to keep his dentist gainfully employed here. With our dental options here at Flex, we can offer you United Health One, Blue Cross Blue Shield, Delta Dental, Medico, and Aetna. With the Medico product, it's available as a standalone or has a great combination that includes vision and hearing at a very affordable price. So let's dive in and talk a little bit more about these particular plans. With UHOne, there are no age restrictions and can be sold to Medicare clients. So they don't care. Some dental carriers cut off at 65 and will not offer it to our over 65 clients. Okay, with United Health One, though, the primary must be 19 or older. So you can't just put kids on a United Health One dental plan. Okay, they have 4 basic plan options. The primary plan has a $1,000 maximum, $25 preventative copay, and 6-month waiting period for basic services. there is no major coverage on their primary plan. So crowns and root canals and that kind of stuff is not covered. After a $50 deductible, the individual is responsible for 30% of the cost. On their primary preferred plan, it has all the same benefits, but adds in the major services after a 12-month waiting period, which is pretty typical in the dental environment. Usually major services are 12-month waiting period. And 50% coinsurance and a 50% deductible for those major services. Okay, I'm sorry, and a $50 deductible. I think I said that incorrectly. A $50 deductible for your major services. Okay, so the bad part is, if anybody's had a root canal, you know you can't wait a year to get that root canal done, and you're going to have to pay out of pocket for it. That's the downside of dental insurance, are those waiting periods. All right, then they have their Premier Choice plan. It also features a $50 deductible and has a sliding maximum from $1,200 in year one to $1,500 in year four. So every year that you're on the plan, your maximum actually increases. And it only has 20% coinsurance for basic services. And again, that same 50% for your major services. All right, the last plan is the Premier Elite, and it has the same structure as the Premier Choice, but allows you to go out of network. And those expenses are covered under reasonable and customary. On their other plans, if you go out of network, you're going to only get up to the network benefit, and then that's it. So if you look at their rates, they are zip code based in Illinois, and so it depends. And then the other thing, and if anybody who's been doing the United Healthcare short-term plans knows that for whatever reason, United Healthcare loves to put in this trend factor. So not only is the rate based on your zip code, as you can see below, but it's also based on when you purchased the plan. So you have to multiply it by the trend factor to determine the rate. So depending on the type of plan, the adult is typically going to be more expensive, and then you just multiply in the trend factor for any dependents, and the adult as well, of course. So just a quick overview. I'm not expecting everybody on the call to remember all this stuff. We have all these brochures available to send to you, but just want to give you a quick overview of the pros and cons of the various dental options. With UHOne Dental, you can add a vision rider. It's $7 for the primary and $6 for each additional person. With United Healthcare, you do get a very good network for their dental providers. It's a pretty extensive network, so you have a lot of options available to you. All right, moving on to our friends at Blue Cross Blue Shield and their dental offerings. Okay, you can see that they have basically two options. They have what they call the 1A and the 1B. And, Blue Cross is always very creative with the names of their plans. For those of you who've been working with their under 65 health plans, it drives you crazy trying to make sure you've got the right plan selected. Okay, 1A is the more comprehensive plan. It offers a $1,500 annual maximum, and it has a $50 deductible up to 3 times per family. Okay, you can add in the kids ACA compliant coverage as well. And then their 1B plan only offers a $1,000 max. Okay, the big difference is your preventative stuff is covered at 100% on 1A, at 90% on 1B. So you're going to have a little bit of out of pocket. Your other services are covered at 80% in network, 70% for your basic services on the 1B, and then for your major services at 50% on 1A and at 50% for 1B. Of course, if you go out of network, you will get coverage, but at a reduced rate. You are going to pay more out of pocket. It's up to individuals, but typically I'm going to tell you that if you're going with a dental plan, you really, really should strive to stay in network. Okay? But that's a quick overview for Blue Cross Blue Shield's dental in terms of their plan and how it works. Again, we have all these brochures that we can send to you. Now, what's weird with Blue Cross Blue Shield, and I don't know why they do this, there are things that Joe doesn't understand. It's only available as a standalone product during the open enrollment period. During the rest of the year, we can't offer it as a standalone product. Of course, anybody who enrolls in a Blue Cross Blue Shield during an SEP does have the option of selecting dental, but it cannot be sold as a standalone product outside of the open enrollment period. Why? I don't know, because it's not like dental falls under the same kind of guidelines as health does. You can see some of the rates here. They do have a couple of different regions. Again, not expecting anybody to remember this. We have this all available to send to you. Just wanted to give you a brief glimpse. All right, I think one of the better carriers in the space, Delta Dental. Obviously, a lot of people have had Delta in the past, whether group or individual. And what's nice about Delta Dental, they allow you to use either network or non-network providers. Of course, you're going to have lower out-of-pocket costs when you utilize their Delta Dental PPO network. That's their primary network, and you're going to get your best pricing if you stay in the network, but you can go out of network. Okay? Now, the difference is when you go out of the network or you go into what's called the Delta Dental Premier Network, those providers can bill members for charges above the PPO network rates. So if you go out and get a root canal and let's say that root canal, the dentist says it's $1,200, but the PPO rate is $800, the dentist can send you a bill for that additional $400 if you go out of network or if you use a Delta Dental Premier Network dentist. So you need to be aware that, again, with dental, it pays to stay in the network. Okay? They do offer an ACA compliant child-only plan. So somebody just needs to get their kids covered. That plan is available. For instance, like on the Blue Cross Blue Shield HSA plans that are very popular. I know a lot of my clients are enrolled in that. Those plans do not offer the ACA dental option, so they may need to add that on for their children. You can get that with Delta Dental. But in the child-only plan, the only network you can use is that PPO network of providers. Okay? The individual plans, if you have it for your family, you can add in those ACA compliant benefits, and it's very, very small amount. It's like an extra $1, $1.50 a month to do that. So a lot of those basic services for your children are covered with no expense to you. So it makes sense for people that have children to add in that ACA compliant benefit. And there are no age restrictions with Delta Dental. They'll take anybody at any time. They're happy. They don't care if you're over 65. They don't care if you're 85. They don't care if you're 2. There is a policy for everybody with Delta Dental. Okay. Now, unfortunately, when I screenshot their plan designs here, didn't come out the best from their brochure, so you probably have a hard time reading it. But Delta offers you 3 plan options: a gold plan, a silver plan, and a bronze plan. Where have we heard those terms before? Kind of sounds like the ACA, right? Unfortunately, no platinum plan. But on the gold plan, the big thing is you get a $1,500 annual maximum. Silver plan is $1,000, and bronze plan is $500. Okay. On the first couple of plans, at 100% for your preventative services, no waiting periods. Your basic services are covered at 50%. Major services covered at 50% on the gold and silver plans. Okay. They also have something called Enhanced Benefit Program. With this, for people that have certain health conditions, there are additional benefits available in these plans for people that maybe they have diabetes or something like that where they have additional dental needs. There are enhanced benefits baked into Delta Dental's plans. So again, by doing a good fact-finding with your client and understanding their situation, this might be a really good option for that client of yours that has diabetes or some other chronic type condition. All right, off of the same brochure and screenshotting, you can see the rates for Delta Dental, and for some reason that comes out much better than the actual plan design information. All right, Delta's premiums are very reasonable versus their competition, and for what you get from Delta. For an individual only, it's only $35.54 a month. Very reasonable. Down below, you can see where I add on a child on the next line down. For 2 people, say you had just a parent and a child on the plan, the premium would be $68.73, but adding in the ACA option of the kids benefit, it doesn't even add $1 to the premium. So it's definitely something you want to do and take advantage of that, something you need to know when you're talking to your clients. At the very bottom of the page, you can see the kids only preferred offering. It's $29.97 per child, and that's up to age 19. You have to be under 19 to get that plan. But at the end of the day, it's a nice option. It's a good plan. I'm very, very much in favor of Delta Dental. Oh, one other thing with Delta that's very interesting that I didn't put on the presentation here is that they will waive the waiting periods for major services if you've had Delta Dental prior. So if you're coming off a group plan and you had Delta Dental and you're coming over to the individual, they will waive your waiting period. So that's very important for people. And a lot of people in the group world have Delta Dental. So it is a tremendous benefit as well. So there are a lot of reasons to like Delta Dental. Okay, our newest member in the stable here is Medico. As I mentioned earlier, it's offered as a standalone product or in combination with vision and hearing. With them, you have to be 18 up to age 89. So they'll take anybody from 18 to 89. And you can choose your certificate year maximum of either 1,000 or 1,500. This certificate, if you do the bundle, includes your vision benefits. So that's important to know that 1,500 or 1,000 is including the benefits that you get with vision. So it's dental and vision combined. Okay? Eyeglasses and contacts are covered after 6 months on the plan, and they give you up to $200 over 2 years towards the benefits. So every 2 years, you get $200 worth of benefit towards your eyeglasses and contacts. The hearing has a separate $500 maximum benefit, but there is a 1-year waiting period for hearing. This is a great, great combo offering for our Medicare clients because as we get older, vision is important, hearing is important, and of course, dental is important. So you get them all three in one bundle package, and the premium is incredibly reasonable. Okay, what's nice about Medico Dental is that their plans will pay regardless of any other coverage. So you could have other coverage paying towards your benefits, and they will pay in addition to it. Non-major services offer a sliding scale. It's covered at 60% the first year, 70% in year 2, and 80% thereafter. So the longer you're on the plan, the more coverage you have for those basic services like fillings and things like that. Okay? They have one of the largest dental networks in the country. It's a guaranteed issue product. Everybody gets it. You have a 30-day free look with the product. So you get it, you get your packet in the mail, get to check it out, check the providers. If you're not happy, no harm, no foul. And they accept either EFT or credit card payments. If you pay with a credit card, it is going to cost you $1 or so more per month than if you do the EFT payments. All right, to give you a quick idea, with the $1,000 certificate maximum, an 18 to 39-year-old client's going to pay $29. At $1,500, it's $37. And remember, this is including dental, vision, and hearing. This is a pretty nice price to get all three of these in one bundle. And you can see as the older we get, of course, the price goes up some. But even for our 80 to 89-year-olds, dental and vision and hearing at $1,000, it's only $38 a month. If you saw with most of the other dental carriers that we offer, an individual premium tends to be right around that price. Okay, if you go up to $1,500, it's only $49 a month. And again, you have vision, hearing, and dental in one bundle. So this is an extremely attractive plan, especially, again, for that Medicare client, maybe living on a fixed income but has these needs. This is a real nice product to offer to clients. All right, the last but not least, we also have Aetna Dental in the house. And they're a little bit different than some of the other carriers. There's some pluses and there's some minuses. Probably the biggest minus to me when we talk about Aetna is there's an 18-month waiting period for the major services, like periodontics, crowns, dentures. 18 months is a long time to wait for that stuff. But what's interesting with them is most other carriers in the space have a 12-month waiting period for root canals. Aetna's is only 6 months. So again, they give it and they take it away here. There's benefits and there's downside to Aetna. So again, it just depends on what your client needs, but it's another bullet in the gun for our arsenal when we talk about dental. Okay, if you look at their rates, they have 2 rate areas in Illinois based on the zip code. Again, premiums, right, like I said earlier, you're going to be somewhere around $38 a month. If you're under 50, a little more expensive if you're over 50. So there's probably some better options out there. But if you have a client that insists on having Aetna, they've had Aetna before, whatever in the group or individual world, we do have it available to you. All right, so let's move on. Let's talk about vision. Currently, we only have one standalone plan, and that's from UnitedHealthcare. Okay, we're looking to add some additional carriers to give you some options, but the only one we have at the moment is UnitedHealthcare. The downside with UnitedHealthcare is when you enroll, you're agreeing to 1 year. Once you're in, and they're going to take your premiums for a month. So there's no getting out once you're in. Okay, there are no waiting periods with UnitedHealth Dental because they got you for a year. They're going to get their money back. Okay, you can go out of network with UnitedHealthcare's vision plans, but of course you're going to get your best pricing if you stay with in-network providers. And what's really nice is that there is no copay for your contacts if you use one of their select providers. So if you just need to get some contacts, I would definitely recommend using a select provider because you'll have no copay. Okay? They offer 2 plan options, and let's take a look at it. You have Plan A and Plan B. Your eye exam in-network is a $10 copay, and you get 1 per year. If you go out of the network, UnitedHealthcare will cover the first $50. Anything above that is up to you. A typical eye exam is about $125 these days. So the individual, if they go out of the network, at least they're going to get that reduced, but they're probably looking at something about around the $75 charge. Okay, for frames on either plan, you get a $150 allowance. Anything above that $150, you can pay, and that's available once a year. So that's pretty good. You can change those glasses once a year. Okay, if you go out of network, they cover the first $75. Okay, for your lenses, it's a $10 copay. If you go out of the network, your single vision is going to be up to $40 covered, bifocals up to $60, trifocals up to $80. Anything above that, the client pays. Okay, the big difference here between A and B is that under A, you choose either contacts or glasses, and contacts are covered up to $125 on A. But with B, you get both contacts and glasses, and your contacts are covered up to a $150 allowance. So that's the big difference between the 2 plans. You get glasses and contacts on B. On A, you only get either or. All right, so you look at UnitedHealthcare's rates, pretty reasonable. The Plan A option is $11.40 a month for the primary, $7.20 for each additional person. Again, you get that eye exam included, and it's glasses or contacts. Plan B, $15.70 a month for the primary, $9.90 for each additional person. The eye exam is covered again, but it's glasses and contacts. So it's a little more robust benefit. So for those people that want both, I would definitely go with Plan B. All right. Another great option to help your clients in today's marketplace. We all know that the cost and our share of that cost for health insurance has been passed on to us. We're paying higher deductibles, higher co-insurance, higher co-pays. People are concerned about those costs if they actually have to utilize their services. Well, Medico provides us with a very flexible, customizable, and reasonably priced option to help offset the potential for those high out-of-pocket risks associated with individual health plans and Medicare Advantage plans. Okay, so it's a way to help protect against some of those out-of-pocket costs if things happen. Okay, what's really nice about this particular plan is you have the ability to customize those benefits to best meet the client's needs. There's a lot of optional riders that you can put in so that you can target the things that the client is most concerned about or what the client most utilizes. You can design the plan and tailor it to their needs. There are 3 base plans to pick from, and these optional riders are available on all the plans. Benefits are payable in addition to any other insurance that may apply. So whether you have health insurance or Aflac or any of these other plans out there, you get paid. With hospital indemnity, the cash is paid to you, the client, not the provider. So you have the option once you get that money on how you want to utilize it. Of course, you're probably going to use that money to help pay off your out-of-pocket costs for that medical expense. And all their plans come with a free 30-day look. So you can take a look, check it out. If it's not what you thought it was going to be for you, you can get out with no harm, no foul. All right, so with option 1, it pays a nightly hospital confinement benefit. You can choose anywhere from 6 to 10 days, and the benefit amounts range from $250 to $600 in $25 increments. So again, you can customize this to the person's needs, their budget, because if you have a typical Medicare Advantage plan, those plans are typically going to have anywhere from $200 to $300 a night hospitalization coverage with a code. That's your copay. Typically, a Medicare Advantage plan cuts that off after 7 days, so you have no additional out-of-pocket. So in this case, on a Medicare Advantage plan, you might put your client on a 7-day plan, and maybe $250 a night is all they need because that's what the plan covers. If the plan's $300 a night copay, put them on a $300 a night benefit and cover that out-of-pocket expense. The premium is going to be very, very reasonable, and it comes with a $1,000 accidental death and dismemberment benefit that's built in with the plan. So it's a nice way to hedge against that higher out-of-pocket cost. On an under 65 plan, we know that for every night in the hospital, we're going to pay a pretty good penny. I'm probably going to look towards the higher side because being under 65, the premiums are going to be lower. So I'm going to try to give them as much protection as I can to help offset those costs. Okay, if you have a $6,000 deductible today on that HSA plan and a 10-night benefit, a 10-night hospitalization, and if you have them at $600, that covers the deductible. Okay, especially in Medicare, but even in the under 65, an observation benefit is becoming a big deal. Medicare, it's really critical because Medicare doesn't cover these observations. More and more, hospitals aren't admitting clients. They're just putting them in observation, and they're just sitting there to be checked out to see whether they need to be admitted or whether they're being sent home. Medicare doesn't cover that. So this is a great way to help those Medicare individuals cover this expense. The observation benefit is going to pay 50% of your chosen nightly confinement benefit for up to 3 days per calendar year. So if the client goes in a couple of times and only ends up in observation and doesn't get admitted, they can help offset that cost of sitting there and waiting that Medicare doesn't cover. They also offer a mental health benefit in option 1 that pays $175 per day for up to 7 days of hospitalization per calendar year for mental health issues. Again, offsetting some of that risk and cost. There's an emergency room benefit built into option 1 that pays $150 a day up to a maximum of 3 times per year for injuries if admitted within 24 hours. So within 24 hours of the injury, you got to go. Okay. Issue ages on option 1 are ages 40 to 85. So it's designed for our older individuals. It's not designed to cover our children having those accidents that our kids will do. But option 1 is a great benefit and a great package for Medicare especially, but works as well for under 65. In option 2, it pays a lump sum hospital confinement benefit. You can choose $1,500, $2,000, or $2,500. Covers 3 confinements per year. So you're helping to offset the cost of that higher deductible on today's plans. Includes that same $1,000 AD&D benefit. Here, the eligibility ages range from 18 to 85. So again, you've got that, even a Medicare Advantage plan person, and maybe even with a 5-night hospitalization, their out-of-pocket's only $1,500, but if they get hospitalized, $2,500, and you can get it up to 3 times per year. So it's a pretty nice deal. Option 3 pays a one-time $5,000 lump sum benefit on day one. There's only one confinement per year on this one, but it's $5,000 right up front. Get a hospitalization, $5,000. Most of that deductible or your Medicare copays are covered. It also includes the $1,000 accidental death and dismemberment benefit, and again, it's available for people 18 to 85. Okay, the optional riders, and these are really great, especially for our Medicare eligible people, because these types of things are definitely more likely to happen because unfortunately we weren't made to last forever. There's an ambulance rider. It'll pay $250 for a ground or air transportation up to 3 times per year. It's not available for people 81 and over, so they do cut it off at age 80. This next one is really a great benefit for our Medicare clients. Daily skilled nursing rider. Because one of the caveats of Medicare is that you have to be hospitalized for 3 nights before skilled nursing kicks in under Medicare. Your Medicare Advantage plan may look at it differently, but if you're on original Medicare, skilled nursing isn't covered during the first 3 nights. So it'll pay $50 a day for days 1 through 20, or $100, or $150, depending on the level of benefit you choose. Or $100 or $150 for days 21 through 100, depending on the benefit level you choose. So it's $50 a day for the first 20. If you're doing skilled nursing beyond that, you can choose either the $100 or $150 a day benefit. Okay, another critical one, outpatient rehabilitation. You've had the hip replacement surgery, you've done your skilled nursing, but now you need some additional rehab. $50 a day for either 15 or 30 calendar days per year, you choose the benefit. Okay, there's a cancer rider available. It pays a lump sum of $1,000, $2,500, $5,000, $7,500, or $10,000. It's a one-time benefit per lifetime. So you get diagnosed with a life-threatening cancer, you collect whatever that amount is. It's not available for people 80 and over. So up to age 79 is the issue age for cancer rider. And then there's an additional accidental death and dismemberment rider. Remember, all the plans give you $1,000, but you can choose $5,000, $10,000, or $20,000. For the full benefit, you have to lose 2 limbs or 2 eyes. I don't know if most people know that about accidental death and dismemberment, but full benefit requires a loss of 2. So I got to lose both of my arms, or an arm and a leg, or both of my eyes. It's great, right? Really exciting stuff. If you lose 1 limb or 1 eye, you get 50% of the benefit, and again, not available to people 81 and up, so the cutoff is age 80. But especially the outpatient rehab, the cancer rider, skilled nursing, those are great benefits, especially for our senior clients. All right, real quickly on critical illness. Critical illness plans will pay you a lump sum benefit upon confirmed diagnosis of various life-threatening illnesses like cancer, heart attack, stroke, and so forth. The exact conditions will vary by carrier. Different carriers will cover different life-threatening illnesses. Currently, we have access to plans from Medico and Mutual of Omaha, and we are actively looking for more options for you. Health insurance pays the medical bills, but who covers the incidental costs associated with life-threatening conditions? Okay, what people tend to forget is, yeah, my health insurance is going to cover my cancer treatments, but typically what happens in these scenarios is the spouse ends up taking time off from work to help care for that individual and help care for the family, so that income is lost as well. So these lump sum payments help offset those additional costs. Oftentimes there's travel involved to a treatment facility, perhaps out of state. They're going to the Mayo Clinic or the Cleveland Clinic or wherever it may be. Okay, there's hotel costs, there's eating costs, there's transportation costs. Health insurance doesn't cover any of those costs. So these critical illness plans are a great way to help offset that big financial hit that people take without dipping into your resources. Okay, so it is a great option for people. And what's cool about most of these plans is they pay in each category. So you could have a heart attack, get paid, survive, hopefully. 10 years down the road, you have cancer, it's life-threatening, you could get paid again. Most of these are per occurrence, first occurrence. Now, if you've already had a heart attack, the carrier will not pay for another heart attack. It's always on the first occurrence of any of these life-threatening illnesses. All right, but at the end of the day, these benefits provide a living benefit when families need it the most. Again, they're taking the emotional burden of dealing with a loved one in a life-threatening situation, and they get that double whammy again of a financial hit as well. Okay, so this is a great way to help protect your clients. Everybody thinks it's never going to happen to them, but look at the cancer rates in this country today. I guarantee you everybody on this call today knows somebody in their family or somebody along the way who's had to deal with cancer. So this is a great way to help those families. All right, so to wrap things up for you, how are we going to get you down the path to success and help you sell more products? Well, it starts, as I mentioned earlier, by doing a thorough fact-finding with your clients. And by asking them the right questions, you will uncover their needs and offer solutions to those needs. You got to get contracted with our ancillary carriers so that you can provide these solutions to your clients. Take the time to learn these plans in order to feel comfortable talking about them. All right? And practice your cross-selling so that you can fulfill your clients' needs and incrementally increase your income. All of these plans that we've talked about today pay very high commission rates. I didn't want to get into each one individually because that would take another hour for us. But every one of these plans pays you well for helping to better protect your clients. Just get comfortable with it. Now's the time. Things are slower. Get ready for the OEP and the AEP. All right, so to wrap everything up, mixing in ancillary products provides your clients with more robust protection. It generates increased earning potential for you as the broker and increases client loyalty and retention. I talked about it earlier. The more products you sell your clients, the longer they're going to stay your clients. Through a thorough fact-finding, it's going to lead you to more opportunities with your clients to be a better resource, a more trusted advisor to your clients. The benefits of cross-selling, you're going to have more satisfied clients. You're going to get more referrals from them. You have a much higher client retention rate by doing so. And ultimately, it all comes back to what's in it for you, and that's more income. Okay? You've helped the client and you help yourself. The thing I love about this business, it really is a win-win business. I truly believe that I help people every single day, and I get paid for doing it. There's nothing wrong with that. All right, finishing up here. It's up to you now. You've got to take the action. You got to get contracted with the carriers. Do your homework. Learn the plan benefits. Practice those cross-selling techniques so that you're comfortable offering them to your clients. And get out of there, get out of the office, get off of your chair, and go help some people. That's what it's all about at the end of the day. That's what we do every single day. All right, I truly, passionately believe in that, whether it's my under 65 clients or my over 65 clients. Flex is actively pursuing additional ancillary carriers to help fill out our portfolio and to help you satisfy additional client needs and generate incremental broker income. So stay tuned. There will be more to come. Also, look out for news regarding an ancillary selling workshop. So if you're not comfortable with this, I'm working on putting together an in-person workshop where we take you through. It'll be very hands-on, very interactive to get you comfortable talking about and offering these products to your clients. Again, it helps them and it will help you as well. So hopefully, at the end of the day, I've been able to spark some ideas to help you survive these turbulent times. We all know the mess that the under 65 market is. Hopefully, most of you have either started or will get started in the Medicare market. And ultimately, we here at Flex, whether it's me, Larry, or Mary Ann, we are here to help you. We are your resource. It's why we exist. Please use us. It's why we're here. You never, sometimes clients say, brokers say, I'm sorry for bothering you. You never bother us. Our job, our reason for being is to help you guys. So please utilize us. phone, email, whatever it takes, doesn't matter. Let us know how we can help. All right, our upcoming events on the 17th, our webinar, Get Ready to Sell Small Group Insurance. With everything that's happening in the individual market, there's tremendous opportunity in group as well. You know, I get very passionate about Medicare, but there's tremendous opportunity. Our group business is growing exponentially. Okay, on the 25th, our Medicare marketing workshop. This is where, very interactive, hands-on, we teach you where to find those senior prospects. With the upcoming annual enrollment period about to start, this is the time to learn to go fish where the fish are. Okay, that will be here in the office at Rosemont. It is limited. I believe we have 10 signed up, typically maximum of 16. Sometimes we'll squeeze 18 into the room. So if you're interested in the Medicare space, please sign up for this. I think it's the most important workshop we do in Medicare. Okay, on the 30th, we're going to be offering the ethics seminar, so you can get your CEUs knocked out and that requirement for your ethics, and that will be here at Flex as well in the Rosemont office. All right, continue to stay tuned to your emails and blasts and all of that for carrier updates, industry news, and all the things that we offer to you here at Flex. I want to thank everybody for taking the time to join us on the call. Again, I hope I was able to spark some new ideas for you. And please just reach out for us. We're here to help. Have a great day. Good luck selling out there, and let us know what we can do to help you out. Thanks so much. Take care.